we're in a crisis mode situation with women's sleep.
One thing that I hear from patients a lot, especially the ones that have success, is I wish I would have done this sooner because I had no idea I could feel this much better.
By 2050, we're going to have a 65% relative increase. That's more than men in the sleep apnea category.
Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Alison Kole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
Hi there, and welcome to a new season and a new episode of the Sleep is My Waking Passion podcast. This episode you are definitely going to want to stick around to listen to. If you've ever felt like your sleep suddenly fell apart during perimenopause, I've had issues with it, but it definitely has not been easy as I've gotten older, or you're exhausted, but your doctor keeps dismissing it, this conversation is going to be for you. I want to introduce you to Dr. Meredith Broderick. She is one of only 175-ish, if I got that number correct, behavioral sleep medicine specialists worldwide. Like, you have that criteria. And she's one of the nation's only triple-boarded physicians in sleep, neurology, and behavioral sleep medicine. So I'm so excited to talk to you today. So after over a decade of conventional medicine, Dr. Broderick founded Sound Sleep Guru, a holistic telehealth sleep practice, because she saw how conventional healthcare's rushed model was failing women with complex sleep issues. She's been featured everywhere. She has a huge social media following. She's been on Nike to Parade, and she just recently co-hosted a webinar with Alloy Health on midlife sleep solutions. So Dr. Mayer, thank you so much for coming on here and talking to me, because let's face it, we're in a crisis mode situation with women's sleep, in my humble opinion.
Yes. Thank you for having me. I'm a big fan of your podcast and I love talking to you.
Yes, we met at Sleep 2025, and I was so dreamy girl over getting to meet you because I'd follow. Social media is a weird thing because you see all this stuff, and then I almost feel like I get to know someone, but they're like, "Who the hell are you? You're a stranger." It's it's just a weird. So then you get to fangirl and then meet people in real life. And it's so much better to meet people in person, is what I'll say. I do somehow feel like I got a glimpse of you a bit on social media. So I appreciate you sharing your presence so openly. So I wanted to start this talk. It might seem kind of obvious to us, especially because we're so familiar with what's going on with women's sleep. But, if everybody knew about it or cared about it, we wouldn't even bother to have this conversation. And the reality is that you must see, because I see it all the time in my practice and have felt it personally, women are exhausted. We're genuinely, systematically exhausted. And this is the thing that, I don't think enough people talk about. I mean, we kind of grew up in a culture where we celebrate the grind, we celebrate the hustle. And meanwhile, we as women are literally, we're falling apart at even a cellular level because nobody's treating sleep as a crisis. And when we're looking at the data for women, right, we've got 1.5 times more likely to complain of insomnia. I was really perturbed by the data that I believe was published in Lancet that was talking about the 30-year projection for sleep apnea for women. And by 2050, we're going to have a 65% relative increase. That's more than men in the sleep apnea category. I mean, these numbers are very, very clear that quality sleep is evading women and millions of women. So I wanted to start by asking you, what are your thoughts on why you think this is such a national health crisis? And why are women's sleep issues so kind of dramatically underdiagnosed and undertreated, quite frankly?
I think there are multiple reasons. And that's what makes it so difficult, is there isn't just one thing. Of course, gender roles, I think, play a role. I think cultural ideas we have about I'll sleep when I'm dead, get the most out of my life, live every day to its fullest, and underappreciating and not being as educated about how important sleep is. I think those all play a role. I also think it's easy to ignore sleep for a long time, just like it's easy to ignore having high blood pressure for a long time and there's no real immediate consequence. Those are some big ones. And then I also think modern lighting and technology and spending more time inside on electronics and not being outdoors and being decoupled with these very important zeitgebers that our sleep-wake cycle has evolved to sort of do this dance with, those I think also play a role. And it's interesting because women going into the workforce and juggling a career and then all the domestic work, it just creates less space for sleep to do this myth of like having it all. So, I mean, I think there's a lot to uncrack.
Yeah. And I think it, you know, in terms of cultural too, it's hard as women sometimes because the division of labor, I've had to work on this myself. We're not always okay with kind of not managing certain things. And that gives our husbands sometimes a little extra leeway to have less responsibility for certain things. And I think being able to be like, no, I need you to help me with this, or find creative ways to do things that you hate if it's in your wheelhouse and you're fortunate enough to be able to afford it. For example, a key would be, I have a lady who helps clean my house. I mean, I would never dust if I was left to my own devices. She comes a couple times a month and I'm like, I cannot even tell you how blessed I am to have this, because it is the greatest lift in my life to not have to do that, because that's how much I hate dusting. So just little things like that, I think sometimes giving ourselves permission to be able to do that. And that's hard.
It is hard. And what you're saying is very true. I think the gender roles are a big part for women. I think especially if you have children, it amplifies it even more, the caregiving aspect of it. So, yeah, I would agree with everything you said.
Yeah. And then my father passed, but just having someone with serious health issues, and my mom fortunately helps me, but those roles are going to be reversed. And sometimes then we're slammed with like parent care too. It's a very interesting world we live in. It's great to have our parents around for a long time, but sometimes as we all age and get sicker and get tireder, it's definitely an interesting situation to grow older these days in the 2025. So that is for sure. Yes. So I wanted to talk to you a bit about your thoughts on what's happening physiologically, especially because women of all ages, we can all have sleep issues. But I think they seem to be, a lot of my patients, I could see that personally for me as well, once we start getting older and we start to get into that perimenopausal age group, some of our patients, we're only seeing them in that age group because they felt kind of fine beforehand. So can you talk a little bit about biologically why it is that our sleep might change as we age as women?
Sure. It's multifactorial. I think the marquee item is the hormonal changes, right? We're having changes in our estrogen and our progesterone. I think our metabolic health is also changing, and it makes a certain number of sleep disorders all come to the forefront. So sleep apnea is one. I think with all of the social stressors, increased problems, having kids, being sandwich generation, those things all lead to increased stress and mental load. Talking about the hormones, we start to get this more erratic secretion of estrogen and progesterone. And of course, the body likes to be in homeostasis. It likes to have the stable ground. And now all of a sudden, things are changing. And these dramatic hormonal shifts create, some of these symptoms we see, like night sweats, vasomotor symptoms that cause problems sleeping. But then also affect things like how you feel during the day. So you can have brain fog or just feel like mood disturbances and contribute to that. So I think it's hard to talk about perimenopause without talking about hormones. And I think those are into the forefront, even though we don't consider that a primary sleep disorder or like a sleep disorder diagnosis. But I think it's part of the picture. It's a piece of the puzzle. So you can't not talk about that. And it's interesting how the tides have really shifted on that over the course of our careers.
We would be remiss that we are taping this at a time when the black box warning for hormone replacement therapy has just been lifted. This is I quite frankly think a really exciting time. And hopefully it has people feeling a little bit more comfortable about what their candidacy is for these types of therapies, to help them. So
It's really interesting because the principal investigator of that study, Bernadine Hilly, the Women's Health Initiative, was the dean of my medical school. And so, of course, we thought, she was a goddess, and, she is and was. And I always think to myself, she died of brain cancer like quite a while ago. And I always wonder how things would be different if she had still been alive to be able to rectify, because I think it's easy in hindsight to sort of point your finger and say, this is such a catastrophe. And I think we have to be careful not to create distrust in the medical system by doing that, because try to think about it from her perspective that in order to get this study funded at that time, you're not going to get a study funded on perimenopause, let's say, back then. She got it funded as a cardiologist to study essentially heart disease. And I just think as a doctor, I try not to have that skepticism about the healthcare system and how easy it is, even with just individual cases, to look back and go, wow, that we really didn't approach that the right way. We should have been thinking this. And also, like, we wouldn't have that data to retrospectively analyze it if she hadn't gotten the funding to collect that data, and still stands to this day the largest clinical trial ever conducted in women. And just to be able to acknowledge that in itself is a win, even if there was like this huge catastrophe in the analysis of the data. And so I think so much of the discussion now is like very negative about the WHI, but I just think maybe it's because I knew her that I just wish she would have been alive to defend it and to rectify the mistakes, and then also to see like the tides turn.
I have not heard that perspective before, and I'm so pleased that you're talking about that, because I think in general, one of the things that happens, with us chatting even about social media, is it's so easy to be like, you're wrong, I'm right, this is just my perspective. And then whatever we look up on Google or wherever search engine we're doing, it's almost like feeding us stuff. They're like, oh, I know what Alison likes, and I know what Meredith likes. And we're just going to keep feeding that. And all of a sudden we're like siloed, when the reality, it's not, regardless of whether you're talking about politics or religion, it's not like I'm right, you're wrong, in my mind. And it's certainly, I think we need to be more open-minded, because we're spiritual beings having a human experience. And I've heard someone say that, and I love that term, because we don't know everything. We only know what we've been exposed to. And even if we use AI, for example, that's a totally different topic. But if you think about where AI could take us in the future with being able to analyze data points, find things in science where we see relationships that to the human eye we're missing, but maybe we can use machines to figure that out too. What she did back in the day was really groundbreaking on so many levels, because ladies listen, we were not even considered part of research trials until much later. I think we were allowed to be in them in like the 70s, but they didn't really do anything about it until like the 90s. So it was much, much later before we're really taking women's health seriously. And even now, it's exciting to see that some of the trials in sleep, they're like, oh, half our patient population was women. I'm like, oh, look at us, because we are fundamentally different, right? I was curious, if you've seen, even in our premenopausal patients, because I've started to really think about this as I've tried to learn and study more about hormones. It was not something that was like on my radar, and now it's become on my radar. That my understanding is even during certain phases of our cycle, and I'm not going to pretend to name them all and rattle them off the top of my head. I don't have that in my notes right now. But, you think about your premenstrual period and stuff. Yep. We can often, right, start to have trouble even when we're like premenopausal with our sleep, just because of those hormonal shifts. So the hormones that you were talking about, they really do drive a lot of our symptoms. I was curious to ask you, what are, like, if you had to name maybe the top 3 sleep complaints that you see women coming to you with, what would you say are like the real challenges that your patient population has been experiencing?
Yeah, insomnia is number one for sure. Insomnia is the number one reason a person will schedule with me. Oftentimes it's a second opinion. Sleep apnea, I think that's pretty common too. I think there is more awareness about sleep apnea, which is fantastic. And I also think I'm seeing younger people and younger women. And, going back to what you were saying about the hormones, yes, I mean, in the luteal phase, there's people have since sleep that once they start their period, it gets better. And then there's also PCOS is a big one that's a risk factor for sleep apnea. I think there's like a 30 times higher risk of having sleep apnea if you have PCOS. There was a teacher at Stanford named Ann Stella Robinson, and she would say, it's DIMS day, disorders of initiating and maintaining sleep. And I think it was an ICD-9 code. But, it's some version of insomnia. And then sometimes it's daytime sleepiness.
So I got to pick your brain about this because I want to know some of the tools that you have found really work. And for those of us listening, when we talk about Dr. Mer being literally someone who has behavioral sleep medicine training, she really understands what the gold standard is, which is not to throw pills at you, but rather to do cognitive behavioral therapy. So I want to step outside the box of cognitive behavioral therapy and the tenets of that and see if there are any CBTI adjacent tricks, especially since one of the hardest things that I found to manage, regardless if it's men or women, though we're tailoring our conversation today to women, is the people that wake up at like 2, 3 o'clock and they can't get back to sleep. And it's really a struggle to figure out a solution for them. I'm going down the rabbit hole of, are they getting suddenly a cortisol spike? Is there something else going on? And I wanted to know what seems to work for your patients. What do you do for them?
My approach is to always really try to fully examine the entire sleep picture. So not just what's going on at night, but what's going on during the day as well. Normally there's more than one reason. There's a circadian component. There might be a sleep disordered breathing component. There could be an anxiety or stress component. There could be a hormonal component. And what I try to do is I try to stratify in my mind which one is the most, which one contributes the most. The only way to come about that is to really assess the person and talk to them a long time. And then, I tell my patients, we're going to be on a journey. I'm not going to be able to solve your problem today. And I might not be able to solve your problem in 3 visits, but I will work with you through it and we'll get to the bottom of it. And we may need to cross a few things off of our list. We might do a very abbreviated form of CBTI where we're not doing a full CBTI protocol, but we're really looking at things that might help sleep hygiene, that might improve circadian entrainment. We might be just looking at stimulus control therapy. Those modalities from CBTI have their own research data that shows they're effective. Not the sleep hygiene, but the stimulus control or, time in bed restriction. I use melatonin a lot. I use light therapy. I think it really comes down to why is that person waking up? And almost always there's a behavioral component to it. Even if like the root cause is sleep apnea or stress, there's a behavioral or a condition component to it if it's been going on for a while.
Have there been any things that you've noticed, like any tricks in terms of people who are particularly very anxious or stressed when they wake up? Things that you've done either even before they go to sleep or when they wake up, or any other like tools in your toolbox that you think have been really effective?
Yeah. So the most common athlete that I'll work with because I live in Seattle is ultra runners, like people who run these like 200-mile races and they don't sleep. And what we talk about is having a sleep ritual. And if you look at any athlete, whether it's a basketball player or a swimmer, they all have rituals because there's performance anxiety, right? And performance anxiety happens with sleep as well. And if you have a person develop a sleep ritual that sort of anchors them into this expected routine, and most of the time it goes well, they can go back to that in the middle of the night and it can help them, it can facilitate falling back to sleep. So that's one way, that's one strategy. Another strategy is something called imagery rehearsal therapy, where you tap into the person's visual system as a way to facilitate going back to sleep. Stimulus control is very important. I think people really, really underestimate how important that is. I see people all the time that they've done a really expensive digital CBTI program, but you really talk to them about the implementation and they're not implementing it correctly, because people just, it's hard to compute why I would get out of bed would help me fall back to sleep, because I know if I'm not in bed, I'm not sleeping, right? But a lot of it is around mindset shifts and teaching people to be more open and have a more beginner's mind, because people develop these ways of thinking, oh, it's impossible to sleep. My brain is broken. I'm wide awake. If I wake up past this time, I'll never fall back to sleep. So in order to facilitate the possibility that that will happen, you sort of have to break those beliefs. You know, I always tell people, you could call it a growth mindset versus a fixed mindset. You could call it positive psychology. You could call it cognitive restructuring. These are just different names. You could call it mindfulness. These are just different names but the way you're thinking about it, you have to open yourself to how to solve it. And then you're open to approaching the problem in a different way.
It's almost like shifting your identity, really. That's how I like to think of it. It's like, how are you identifying? Are you identifying as that person who will never sleep? Or are you kind of open to saying, I want a different identity? Like, what's my ideal avatar, if you will?
Well, I mean, would you agree that there are some people with insomnia, and you could name any medical disorder? It could be someone who has seizures or is dizzy or has migraines. The same sort of phenomenon happens where people do identify with the diagnosis in a way. And, you know, those are some of the inspirational stories that we read about, are people who didn't let their leg amputation define that they were not an athlete. And It's so inspirational. And so that's what we're trying to do, is say, yeah, sure, that you do struggle with this. It is a big deal. It is really annoying, and it is stressful and serious for your health. However, let's figure out, where do we have, a way to do something about it? What can I do? I was just rereading Rafael Paleo's book recently, and he was saying, like, his mantra was, I will fall back to sleep. I always do. And if you ask someone with insomnia, like, it's very rare that even someone with severe insomnia will never fall asleep the whole night. And so if they can at least believe something that's not as bad, those sorts of shifts are incredibly powerful.
Now, there are so many commercial nowadays / FDA approved type devices. Modius would be one that's FDA approved, but then they have other ones that are saying, okay, well, I can help induce a deeper level of sleep, and these other descriptions that they're using. I was just curious, because it's like one of those things where if I could wave a magic wand and like have endless cash, I probably would buy all these things just to try them, because I'm very curious about tech. But I was wondering if you had any real world experience with any of these adjunctive, be it commercial or non-commercial devices, helping your patients have a way to get to sleep a little bit faster, or maybe begin to see that they can restructure their thoughts around sleep using this tool.
I have used the Modius Sleep in my clinic. I've had a few patients, not a lot, I will say. I think, I'm a consultant, a medical advisor for Oslo. They use
the earbuds,
sound masking, technology. And so I think these devices, let's use the Oslo Sleep Buds for instance. They have a very specific purpose, which is to help people that are having trouble sleeping because of environmental noise, which we know is a social determinant of health. We know it's important. People even subjectively will say, like, my neighbors are noisy, or whatever noise, right? So for something like that, yes, absolutely, they help, if that's your problem, right? So if you have chronic insomnia, well, no, that's probably not going to help you. It might help you a little if, like, your spouse is the reason, or your bed partner, I guess.
Get checked out first, not just drowning them out.
Yeah, and I want to empower the person who's having trouble sleeping, that you're not relying on that person to do their due diligence, or waiting for them to go through 3 months of appointments before we can help you, right? So I do think that's one reason why I like the Oslo Sleep Buds. Plus, let's face it, there are some bed partners that they're not going to fix it, right?
You're like, well, I love you and I want to stay with you, so I'm going to have to figure out a way to sleep around it. Yeah. And a sleep divorce is not always possible, where you just vacate the room. Sometimes it is, but not always. But I love that.
Yeah, a lot of people don't have the space. I saw this ingenious invention on Instagram recently, and I was talking to the inventor, where it's kind of like the Scandinavian method where there's two twin beds together and then they pull apart and this other bed like comes in. So it's for if you have like a dog or a kid that comes to sleep with you. And I love stuff like this because I think there's so many different people and so many different situations and reasons why they can't sleep that all these tools are helpful. But the crux is really, is it the right tool for that problem? And so you can't just say like, oh, you have insomnia. Let's
Right.
try the Oslo Sleep Buds or let's try the Modius Sleep. With Modius, I have seen some benefits from it. I tend to try it more in people that are refractory to CBTI or they're not really, they don't want something that requires such a time intensive or it's a very complex case where there's, history of trauma or things like that. But my approach is always very minimalist. If I can get you to sleep well without a device and without a medication, you're going to be happier with me and I'm going to be happier with the work I did. But I do use those tools. I do like to use them, even if it's just to facilitate a process of better and better and better. And then you're kind of minimal. I don't know. What do you think about these devices? I'm curious what you think.
Yeah,
too.
I mean, I've talked about Modius a lot, and I've actually tried it to see what that sensation would be like. And I have to say, I did feel like, I was like, oh, I kind of feel like I'm more sort of chill. So I think it could be useful for patients. And I'll talk to them about these tools in case they're interested. But to your point, for example, trying to pinpoint what it is. And sometimes my patients will say, I'm just very sensitive to noise. And if the littlest thing will wake me up. And I'm like, what if you block that out? Would you feel comfortable? Some people are naturally hypervigilant. That's a little different if they feel like their environment needs to be really safe. Okay, can we create, you mentioned a bedtime ritual around that. Can we do something that will allow you to really feel secure in the home that you're in? Some of the other things that I think have found helpful, I've had people who run really warm at night. Or one of their complaints is, and it could be from hot flashes, but sometimes it may be a male patient, for example, and they just happen to know that they're going to wake up sweaty at a certain time of day, however it is, in the middle of the night. And they've really responded well to like those cooling mattress toppers and stuff. So I'm like, hey, if that works, great. And then I've had folks who have kind of an ADHD component. They're kind of hard and squirrely to get to really concentrate, and something like a weighted blanket feels really comfortable to them, or even a weighted pillow. So sometimes these other little ancillary things seem to do a whole lot. But most of the time, I'll tell you, I agree, trying to really get to how do I work with you as the individual? And that's a path. You've been into concierge a lot longer than I have. And because we can spend, that's why Meredith and I do what we do. We can spend a lot of time with our patients. And the more I do it and see these complex cases, it's a journey that we are on. And right now, I was talking to a patient who I spent an hour with, and we were going through various modes because there's a touch of sleep apnea. There's some other things going on. I'm like, okay, well, these are some options for us to try. And we've even done things as though he's like, well, I have a wedge pillow. I've not really tried it. It's in my closet. Let's give that a whirl. And then you sort of start to check the boxes of what's helping or not helping, and getting them to that next kind of step, I think is so helpful. So yeah, great advice today. Do you have any final words or things that you want the ladies listening to leave home knowing that they should do? What advice do you want to give them as we wrap up?
The reason why I went into sleep medicine and behavioral sleep medicine is because I could see, as a neurologist, taking care of people who have a terminal diagnosis or have had a stroke, that prevention is the best thing we can do. And it's sort of hard to see that ahead of time, but you can get through life day by day and ignore these things. But one day there's going to be a straw that breaks the camel's back. And I think that you have to think about the risk of not doing anything, of seeing the signs and thinking, well, I've been managing this. And I don't know if you hear this, but one thing that I hear from patients a lot, especially the ones that have success, is I wish I would have done this, or I wish I would have done this sooner because I had no idea I could feel this much better. And I think some people just don't know it's possible. We just frame it as it's impossible to sleep well when you're in perimenopause or menopause. It's just part of it. No, that doesn't have to be true. It is possible. I see it every day, but it does require some time and attention, but hopefully it'll be worth it.
Thank you so much for your time today, Dr. Mayer. I have, if it's okay with you, I wanted to see if I could keep recording and just ask you like a couple of rapid fire questions. What's your personal wind down routine as a sleep doctor and mom?
My favorite wind down is taking a bath before bed. Although I will say with a 2-year-old and a 7-year-old, I don't always get to do it. I do always try to read a little bit. I love a very dark room with a very low red colored light, a clip-on book, and I always try to read for at least 15 minutes before bed. So very simple, low light, a bath if possible, and reading.
Oh my God, I love that so much. It's also the simplicity of it, right? Getting people to not do complex routines that are almost impossible. I think that's one of the other things I've learned through this journey is that sometimes we recommend too many things and maybe somebody's trying to assimilate all of that. And then they're like, oh my goodness, I now have a 10-step or a 15-step process for getting to sleep. Simplification can be awesome. What do you say to women who feel guilty about prioritizing their sleep?
I think I would ask them why, and I would probe them why they feel guilty. What is at the root of that? A lot of us were raised in a generation, I mean, I don't know, you might not be as old as I am, but that your worth is tied to your productivity.
Girl, I think we both Gen X, faux shizzle. So yeah, I mean, we're the sandwich generation practically, like, bye-bye, figure it out on your own.
Yes. So I think we just have to look at the science and know there's a point of diminishing returns. And I always think about my experience doing my neurology training at Case in Cleveland and then going to the West Coast at Stanford and being with sleep. And so like the contrast between the hard-nosed, like East Coast mentality, I'll sleep when I'm dead, you're a weakling, to like, let's enjoy life. The science shows us we'll be more productive and more creative if we just get off of work at 5 and take Fridays off. You know, we know that if you do take that time, it yields benefits. So I think part of it is helping people tap in to believe that and giving them a roadmap. Like, how do you actually make that happen? How do you take the things out of your life that aren't actually that important that can wait, right? Like part of it is prioritizing.
Struggling with sleep? Dr. Kole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at askthesleepmd.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit askthesleepmd.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.